go ahead and get started. Thank you for coming today. We have a really exciting meeting planned for you guys today, something we haven't done before. So, as you saw from the post, and as you can see from the title slide, we're going to be doing a disease diagnosis lab. Today focused on respiratory diseases. So, you guys are going to be able to have some discussions with yourselves and with your friends, and then we'll follow up and do a recap about it. So, I'm going to hand it off to Hirsch now, who's going to go over some information for our slides.
Yeah, so for this is something new that we're doing. We haven't done this before. But what we're trying to accomplish is to give you guys an idea of how disease diagnosis works in the real world. So first we'll be giving you guys a presentation about 3 different slightly related diseases, and it should be pretty quick. After that, we'll open up breakout rooms and you guys can go into rooms with your friends. And there you'll be presented with a case study by one of our team members. And you'll have 5 minutes or so to try to decide what treatment option it is or what disease it is using the information you're given in this presentation and a document we'll share with you right after. Um, yeah, so that's how diagnosis would work. We would close the breakout rooms right after, so you guys can present your ideas, and we'll repeat that for 3 different case studies, so that you guys get a better idea of diagnosis. And I'll explain more about the breakout rooms after our presentation. So we'll get started now. The first disease is chronic bronchitis. So chronic bronchitis is a disease in the respiratory system. It causes inflammation of the airways. And because of that, there's mucus buildup and it's really hard to breathe. So that's why some of the symptoms include coughing, especially with mucus, shortness of breath, difficulty breathing, and tightness into the chest. So the risk factors, the leading cause and risk factor of chronic bronchitis is smoking. I think that's pretty obvious because there have been so many studies showing how smoking can be harmful to the respiratory system. Other possible risk factors are air pollutants. So it can be fumes, dust, secondhand smoke, basically if you live in an area with a high amount of pollution. And also being above 40, since this is a disease that typically affects older people. Now, there are many tests to see if you can, to test for whether or not you have chronic bronchitis. So firstly, there are CT scans, which allow doctors to properly see your lungs and the area around it. Sputum testing. Sputum is the mucus in your lungs, and testing it can allow you to see if there's bacterial infection and thus determining if it's a cause of chronic bronchitis or something else. And finally, there's a pulmonary function test, which is just a measure of how effective your lungs are. So it's more of a subjective test.
All right, some of the main medical treatments for chronic bronchitis include bronchodilators. This is basically just medicine that relaxes the muscles and opens up your airways, like Hirsch mentioned before, those get closed up. There's also rehab for this, which consists of like breathing exercises, working on your diet, um, and other tips that the doctor will give you to improve your breathing. And in pretty severe cases and not as common, you would have a lung transplant, which obviously comes with a lot of potential risk, um, but that is a last case option. In terms of things that you can do in your lifestyle or in your everyday life, so obviously quit smoking if you are still doing that, because like Hirsch mentioned, that is the leading cause for chronic bronchitis. And also wearing a mask to help reduce exposure to the pollutants, similar to how we're wearing a mask now to protect ourselves from COVID.
Now I'll be going over the second respiratory disease, which is asthma. So asthma is a condition in which a person's airway becomes inflamed, narrow, swell, and produces extra mucus, which can make it really difficult to breathe. And some symptoms of asthma include wheezing, which can manifest in a whistling sound when breathing, breathlessness, a tight chest, and it may even feel like a band is tightening around the chest, coughing. And some tests to test for asthma include a FeNO test, spirometry test, peak flow test, and allergy/lab tests.
Yeah, so for current treatments of asthma, there are currently no cures, but treatment can help you control it and you're able to live a normal, active life. So the main ways that we can control it is A, through inhalers. So there are reliever inhalers, which relieve the symptoms when they occur There's preventer inhalers, which stop symptoms from developing, and then there's combination inhalers, which technically are a combination of both. You also have tablets such as LTRAs, thiopheolin, and steroid tablets that help stop the symptoms, or they help control the symptoms when they actually occur. And there are multiple injections that you can get prior as well, such as Frustrina, Zoller, Nucala, and Synchrocra. These are the pharmaceutical names, and they pretty much get them when you know that you have asthma, and they help like suppress the symptoms so they don't occur as often. Going on to the causes of asthma are also technically unknown, but there are a lot of different ways it can be effective. The first one is through genetics. There's also pollution, since that can trigger allergies. There's modern hygiene standards, and pretty much there are multiple triggers that could also trigger having asthma, such as infections, allergies, smoke, medicines, and weather. So pretty much all of these factors come together to pretty much trigger this asthma or make it worse as time goes along.
So our last disease is emphysema. Alongside chronic bronchitis, emphysema is a chronic obstructive pulmonary disease, or COPD for short, and that stands for chronic inflammatory lung disease, which causes obstructed airflow from the lungs. However, in contrast with chronic bronchitis, which causes damage to the bronchial tubes, emphysema essentially causes damage to the air sacs in the lungs, called alveoli. It's caused similar to chronic bronchitis and asthma by smoking, but it can also be caused by air pollution, age, and chemical fumes. Emphysema patients experience shortness of breath, cyanosis after physical exertion, which essentially stands for example, their fingernails will turn a bluish tinge after running or working out, and they cough and wheeze. Some tests for emphysema include CT scans and chest x-rays, spirometry, which is essentially if you've ever been to the doctor and you had to blow out a fire, that's what a spirometry test is, and alpha-1 antitrypsin deficiency test, because often emphysema is caused by an alpha-1 antitrypsin deficiency, where the protein that protects the elastic structures in the lungs is deficient in the body.
So while there's no like cure for emphysema, there's various treatments that can help you deal with the symptoms. So these treatments include bronchodilator medications, which widens the bronchi to allow for better breathing, steroids to help deal with like immediate pains, antibiotics, oxygen therapy to help with breathing, and then in severe cases, surgery and lung transplant is an option to remove like infected parts of the lung. In addition to what Kushal said about the protein deficiency, infusions of AAT may be given to help slow the progression of lung damage. And another option is also rehab to guide better breathing strategies and quitting bad habits such as smoking.
Okay, so we'll get to the Kahoot later. Right now, we're going to be doing the diagnosis lab, as we mentioned earlier. So how this is going to work is that we're going to open up breakout rooms, and there will be 3 breakout rooms. So we're trying to get an even number. So 2 breakout rooms with 4 people and 1 with 3 people. So you guys can go into the rooms with your friends. And in each room, there will also be a moderator. So what the moderator will do is post the case study for that round into the Zoom chat so that everyone can see. And then you guys just want to discuss based on the information we just presented and a document that we're about to give you. And using that information, you want to try to diagnose what disease it is. Yeah, so firstly, I'll share that document. Get the link.
And also, some of the diseases might be repeating, because I know we covered 3 different diseases, but there might be 2 of one type of disease. And also, we'll have around 5 minutes per breakout room.
Yeah, exactly. So I shared the link in the chat, so if you guys just want to open that up. So that has some of the similar information that we just covered. And like Shreyansh mentioned, we may have repeating diseases, and you guys will have 5 minutes for each disease. After each disease, you'll come out back to the main room and just discuss what your potential diagnosis was. And then at the end of all 3 rounds, we'll give you guys the correct answers. Does anyone have any questions about how this is going to work? Okay. Also note that since we are trying to have an even number of people, some of you guys may be moved out of a room if there are too many in one and not enough in another. So please try to balance yourselves out because we don't want to have to move people. Yeah. Okay. I'll open up the rooms. Okay, so the rooms should be open. You guys can just join a room with your friends and get started.
Hey, Sahas, can you move to the breakout room, please? Cool. So what Shriyansh saying is, it's in the same order as the disease document. So maybe we should do it in a different order.
Sure. Why do we go backwards?
Yeah,
just go backwards.
backwards works.
Backwards is fine. All right. So let's do the what is last chronic bronchitis first.
Wait, but hold on. The
Oh,
order
no.
right now is backwards.
Yeah, because we did chronic bronchitis, then asthma, then emphysema.
So this order is actually fine, right? What's on the disease?
So the thing is, isn't the disease document in the same order?
Oh, the document that we just shared. Yeah.
Yeah.
Because they're going to be looking at that.
Okay,
Because
then
chances are,
just switch it up completely. We'll do asthma first. Here, I'll write it down on the document.
Oh, I see what you're saying.
Asthma first. We'll do emphysema second,
Okay. Perfect.
and then chronic bronchitis. We'll keep it as there.
All right. That sounds good. Let's move ourselves to the breakout room. Let me see.
I'll be a moderator for one of them.
what was the
Alright.
order? Can you just send it in the officer chat?
Sorry, could you repeat that?
Can you just send the order in the officer chat?
I'll set that right.
So Yusuf, do you want to go to room 1?
Let me take room 3.
Okay, room 3. Shriyan or whoever whoever wants to take room 1 and 2, just let me know.
Okay, I'm gonna go over and head over to room 3. Okay.
All right. Okay, I'll take room 2 then. And then is anyone okay with room 1?
I'll take room 1.
All right, then go to room 1 and then copy in the asthma, and then Meher, Harsh, you guys can stay here for a bit.
Okay, so then I think you guys all got the chance to go through that first case study. So can one person from each group you can open your mic and explain what you thought the disease was for that one.
Yeah, okay. So we're room 1, right? Okay, so we think it's asthma. Primarily because number 1, you have the age, right? So emphysema, you need to smoke. This kid's 5 years old. I highly doubt he's smoking at this age. It also didn't list that his mother was smoking during pregnancy. Chronic bronchitis, that develops later in life. So at least 4 years old, as it says on your document. So once again, this kid's 5 years old, highly doubt it. So through reduction, you can just say asthma. But also, you learn that he's taking albuterol, and that's an inhalation drug used to treat asthma. And he does have the symptoms such as like fatigue after exercise, like but a lot of coughing and whatnot. And also he has what do you call? He's wheezing too, and his FEV test shows that he's at 60 to 80% inhalation exhalation. So we think it's asthma just due to that.
Okay, that was a really nice explanation. The other groups, room 2 and 3. Does anyone know?
We also thought it was asthma because of the symptoms of wheezing and a dry cough and the fact that he can't keep up with other children and because of the treatment of albuterol.
Likewise, we said it was asthma because we ruled out the other symptoms due to his age, and then albuterol medication is for asthma. So yeah.
Okay. Yeah, so we're not gonna tell you guys what the right answer is right now, but I'm gonna reopen the breakout rooms, and then you guys will be presented with another case study, and it'll be the same people, same moderators. So yeah, I'll open them up. You guys can join your rooms again. Okay, so that was the second case study. We'll switch up the order of presenting this time. So group 2, do you guys want to go first?
Yeah, basically we started off by looking at the age. So essentially she's a 50-year-old woman who's been smoking for 30 years, 1 pack a day. So that's like obviously a lot of smoke to be inhaled, which means that she's definitely at risk for probably chronic bronchitis and like emphysema more than asthma, just because like if you you'll be deterred from smoking if you have asthma, like if you smoke while you have it, because that's really annoying. And also like she's just presenting with this now as opposed to being younger, so that's probably not asthma. But then also it talks about how the alpha-1 antitrypsin has a deficiency, which means that the alveoli probably aren't functioning properly, probably because of her smoking. And also like the empty spaces in the lungs probably points to the fact that it's emphysema.
Okay, we can go with group 3 next.
We also thought it was emphysema because of the smoking, plus the symptoms match up with emphysema, such as the blue or gray fingernails after physical activity. Additionally, it stated that there was damaged alveoli in the lungs as opposed to inflammation in the bronchial tube, which is a main symptom of chronic bronchitis. So we thought it must be emphysema.
Okay, and finally group 1.
I mean,
We-
like, oh, sorry, Elias, if you wanted to go, you can go ahead.
Okay. Yeah, we also thought it was emphysema because of the damaged alveoli, AAT deficiency, and the cyanosis of the fingernails.
Okay, so we have one last case study for you guys. So I'll open up the rooms again. And after this round, we'll do the presentation again and we'll reveal what the final answers were.
On the playground, emphasizing that there was a lack of breath. It was harder for him to take deep breaths, making it harder for him to exercise. It also intensifies when he's lying on the floor, showing that like his airways are being blocked, which is also a very common feature of asthma. Then we also return to the tests. So you can see that bronchitis, asthma can often spring off of that since it was a current problem. So that was another major clue on the past diseases often lead up to this. And also the treatment is one that's often given to asthma patients. And I'll go ahead and let Angela explain the tests and everything.
So the second disease was emphysema
Wait,
because
Shreyansh, she was gonna explain.
oh sorry.
Yeah, so about the test, basically we kind of mentioned how the FEV1 forced expiratory volume is 60 to 80%. So in order to get this value, you must use a spirometry test, which is also a big clue about the disease being asthma, since in the slideshow we also mentioned that that is one of the tests you use to get either asthma or diagnose bronchitis. So that was also a major clue that you guys could have used to diagnose asthma in the end.
Okay, Shreyansh, if you want to explain the second case study.
Okay, so yeah, for the second disease, it was emphysema. So the first factor was that the woman lies between the age that we discussed, which we said was 40 to 60, I believe. Obviously, shortness of breath is not specific to just emphysema. That seems to be a symptom that was common to all 3 diseases. But another key thing that we said was that she noticed cyanosis specifically in her fingernails after physical exertion. So that we pulled like straight out of the slide. So that should have given it away. And then another thing was the deficiency in AAT. So while not all cases of emphysema have deficiency in AAT, it seems like that's one specific thing to emphysema. I don't think chronic bronchitis and asthma have low levels in AAT. So that was another key factor that should have been used to determine that it was emphysema. And also we mentioned that there was damaged alveoli, which was another key factor that should have indicated that it was emphysema.
Okay, for the last one, it was chronic bronchitis. So there were a couple of things that were relevant to that, to chronic bronchitis. So obviously this was a harder one, and it's obvious that it's confusing between emphysema and that. Firstly, it said that the man had felt similar symptoms in the past. So that's suggesting like repeated cases. And as it said on the document, chronic bronchitis occurs in episodes. And it's just that in chronic bronchitis is when these episodes occur more frequently. Secondly, I think group 2 mentioned this, but there was regular levels of AAT. And although AAT there can be low levels of it in chronic bronchitis as well, it's low levels of it are more significant in emphysema. And finally, it's the cold medicine. Since he's taking cold medicine, we can infer that he had symptoms similar to fevers and colds and maybe some fatigue. And that's, although it's also possible in other diseases, it's mainly relevant to chronic bronchitis. Okay, so.
Hi guys. Sorry. Okay. Before this meeting comes to an end, I just want to send out a feedback form for everyone who attended and participated in the lab today. And it would be greatly appreciated if you guys could fill it out so we can continue planning events such as this and make improvements in the future.
Yeah, so like Angela said, this is our first time running this event. So it would be really helpful if you guys could fill out that form. Yeah, so we're hoping you guys enjoyed this meeting because it's something new and we felt it was a little more interactive than the stuff we've had in the past, not just a presentation and a Kahoot. And we're hoping to hold more events like these in the future where you guys can have more hands-on experiences. But before we leave, I was just asking if you guys could each share one thing that you learned specifically from this event so that we know that it had a positive outlook. One person from each group can share maybe.
I mean, like, I guess first off, right? It really shows like how difficult it is, I guess, to kind of diagnose someone, right? Because, just like in the last case, right? You did have instances where symptoms were similar. So you really need to get into like the nitty gritty and into like the details, right? Specific details. You need to be very detail focused in order to like actually find correct diagnosis. Because like in the world of medicine, if you don't diagnose correctly, you might actually you might actually be the cause for someone like dying. And there are cases where like malpractice, like unintentional malpractice occurs because of misdiagnosis. So
yeah, that's really important. Actually, that's true. Everything you just mentioned. Does anyone else want to speak out, maybe from the other groups?
I think we also learned how many factors you have to consider when like giving a diagnosis. So yeah, it was something that I think we all kind of learned through the process of like looking at all of the risks and the symptoms and the treatments to kind of reach a final conclusion.
Okay. And anyone from group 2, if you guys want to talk.
Yeah, sure. So I think like we all learned that like how to factor in like symptoms and like previous conditions. Like I know for one of them, it was like they were taking cold medicine. So like we had to factor in that. And then like the nails, we had to factor in that. And like we had to like basically like include all of them and try and come to like a final decision, even though there might be multiple.
Okay, yeah, thank you. So we did have a Kahoot for you guys, but we're approaching the end of office hours. So what we'll do is do the Kahoot next time. It's about the diseases we went over today. And so we hope to see you guys all at that meeting. Yeah, once again, please fill out the feedback form and we'll see you next time. Bye, everyone.
Bye, everyone. Thank you for coming.
Bye, everyone.